Subscribe to Clinical Guruji's channel and press on the bell icon to never miss the latest video.
Hello friends, you are watching Clinical Guruji. In this video, I'll tell you about Chickenpox or Varicella. Varicella zoster virus is a dermatophobic and neurotrophic virus that produces primary infection, usually in childhood, which may reactivate in later life. Varicella zoster virus is spread by aerosol and direct contact. It is highly infectious to non-immune individuals. Disease in children is usually tolerated. Manifestations are more severe in adults, pregnant women, and immunocompromised. Now comes to its clinical features. The characteristic rash first appears on the trunk on the second day of illness, and then face and finally on the limbs. The lesions are maximum on the trunk and minimum on the periphery of the limbs. The lesions appear as macules and progress to papules, vesicles, and pustules. The lesions finally dry up to form scabs. Lesions appear in crops, so that lesions at all stages of development are seen in any area at the same time. Low-grade fever is often present in chickenpox. In immunocompromised patients, the lesions are hemorrhagic and are numerous. Dissemination to other organs is quite frequent. Now comes to complications. Complications are myocarditis, hepatitis, corneal lesions, bleeding diathesis, perinatal varicella, cerebral ataxia, meningitis, acute glomerulonephritis, interstitial pneumonia, arthritis, osteomyelitis, congenital varicella, Reye's syndrome with aspirine. Now comes to its diagnosis. Diagnosis is primarily clinical by recognition of the rash. If necessary, this can be confirmed by detection of the antigen by direct immunofluorescence or DNA by PCR of aspirated vesicular fluid. Serology is used to identify seronegative individuals at risk of infection. Now comes to management part. No treatment is required in majority of cases. Symptomatic treatment includes antihistamines and local calamine lotion. Acyclovir can be used in adults or immunocompromised patients. It reduces complication of chickenpox, particularly if given within 24 hours. In immunocompromised patients, acyclovir is generally given intravenously. Other drugs that can be used include valacyclovir, famciclovir. In healthy children, use of antiviral agents may reduce the duration of disease when given within 24 hours of symptoms. However, since the disease is generally self-limiting and symptoms can be controlled and reduced with supportive therapy, antivirals are often not given in children unless they are immunocompromised or on long-term salicylate therapy when Reye's syndrome may develop. Secondary bacterial infection is treated with local antiseptic or systemic antibiotics like cloxacillin. Now comes to last part, prophylaxis. A live attenuated vaccine is available for the prevention of chickenpox in immunocompetent children and adults who are at high risk of infection. It should not be given to pregnant or immunocompromised patients. Passive prophylaxis using zoster immunoglobulin or varicella zoster immunoglobulin may be given to immunocompromised persons or pregnant women with history of significant exposure within last 96 hours. It should also be given prophylactically to an infant whose mother develops chickenpox up to 7 days before delivery, or if the mother develops chickenpox up to 28 days after delivery. So these are all about chickenpox. If you like this video, hit that subscribe button and share with your friends. Thanks for watching and hope to see you in my next video. Bye bye.